let's put this graphic up because sometimes it's even fantastic when you're able to read as to when you need surgery.
Yeah.
And this is exactly what you just said, doctor, but I always believe that seeing things make it even more real. Severe pain during activity, pain that prevents activities, which is exactly what you just said.
Yep.
Pain at night that hinders sleeping. All of these are wake-up calls that you need to see a doctor. So let's say the patient right now says, I have all those three. We have someone out there that's going, I have it all. What can that individual out there expect when they come see you?
Well, you know, the treatment of arthritis or hip and knee arthritis, it's really a stepwise management. And usually you start with simple interventions just to see if it will improve the situation. And what I'm talking about is stuff like healthy living, so healthy weight management. If you look at some of the longest running and best studies we have out there, patients that had a reasonable weight loss, so I'm talking about 10 to 15 pounds, had a significant improvement in pain in their arthritic knee or arthritic hip. So sometimes that's all you need, some healthy living. Other things that we can add to that, medications to improve inflammation. So these are anti-inflammatory medications. There are many different types, over-the-counter, prescription strength. They all kind of work in the same way. They do have some side effects, but they're effective in minimizing the inflammation in the hip or the knee associated with arthritis, so they can just make it more tolerable. The other thing we can do is injections into your hip or into your knee. And those can also just make it more tolerable. None of these things will cure the arthritic damage that you have. There's only one cure, and that comes in the form of surgery, in the form of replacing that damaged portion to reestablish the natural anatomy of your hip or your knee.